Hi, Sandy.
Good afternoon, or good early evening. 5 o'clock. We'll call the Health and Human Services Board to order at January 15th at 5 o'clock at the St. Croix Government Center, room 1400. Roll call, please.
Greg Talajon.
I am present.
Sean Anderson is excused. Mike Barkalow.
He's present.
Kathleen Finley.
Present.
Kathy Leaf.
Present.
Lisa Lind is excused. Deb Lindeman.
Present.
Dave Osnes is excused. And Julie Smith.
Present.
Minutes were in the packet. Is there any changes or corrections or discussion of the past minutes? If not, they'll stand approved as presented. They are approved. Any public comment tonight? Any public comment? Any public comment? I guess there's no public here. So, business, financial report for December 2024.
Good evening. So the financials through December 2024 were included in your packet. So a couple of things on this first page. You'll notice here on our State Human Services grant, we're $1 million, 1,506,000 to the good. And then when we look down at our Human Services line, we still had 3,500,000 left to receive. So our CCS cost settlement money from 2023 came in and got posted on the wrong line. So that was $2,105,000. So we'll journal entry that and switch it to the right account number, and those will bring the balances to where we expect for those two lines. For CCS, we still have 2 months worth of income coming in, so that should put us right where we expect to be. Other than that, just a reminder, we will have additional revenue that will continue to post to December 2024. We'll have payroll expenses here from January and invoices paid in January for services that were received in 24 that get posted back. So these December numbers are not final and will continue to change. So yeah, children's services, if I scroll down, whoops, that's my, wow, I'll go over here. Sorry about that. So just want to point out again, we've talked about it throughout the year that our purchase services and children's services are over what we had budgeted. We do plan to use fund balance that may to cover that. So that was really all I had. So again, here was that extra money in humans on our HHS admin that belongs to CCS, so we'll be moving that money. We did get in our regular cost settlement money. We had budgeted $525 for WMCR, and we got in $626, so that was a nice addition. Any questions on human services? So with the healthcare campus, if you notice, our revenues are very similar to where they were last month at this time. This report was run prior to our revenues being posted. So when you look at right now, it's showing a net of $447,000. We have $656,900 in revenue that has been posted. It just did not show in this report. So the healthcare campus as a whole is still doing very well. We have some depreciation posted, but not all of the depreciation has been posted yet. So once that goes in, and then we'll also have funds to pay back down on the debt. And then just one thing to point out with Kitty Roads, for the dementia crisis unit, again, we have that grant that's coming in, so we're spending a lot of money in that account, and that, because it's state funding, comes in about 2 months after the expenses get reported. Any questions on the healthcare campus? Okay, thank you.
That's it. Dementia Crisis Stabilization Unit updates.
Mr. Chair, I'm going to have Sandy provide an update on the progress so far in the DCSU. That's all right?
Currently, we continue to work to fill our positions. We are working right now actively this week on 3 full-time people, which would just leave us a small part-time position open. So that's exciting. Not that it's all been finalized with each of those people, but we're working on those 3 full-time people. We have several people that transferred over from the nursing home or from Orchard View into Kitty Road, so we're pretty excited about that. With the grant, we have the unit really set up well, and I think that we haven't heard from anybody that they're interested in a person yet. We did have one referral, but that referral was on a permanent resident, and that's not going to be the intent of what Kitty Roads does. So we have worked on the MOUs and intercounty papers so that we can have agreements with other counties to help with anybody else in the area that has crisis needs. Okay. So, do you have any questions?
So hopefully those 3 will come through, but how quickly, once you are staffed, would you be able to take patients?
We'd be able to take them right away when we're staffed. We can put in, continue education of the staff people. We have one program that we're requiring of it's called Dementia Cares, but it's a 40-hour education. So we could have that be completed during the first few months of their employment, and that's what we would do. The CBRF is also like that. They're required to do several classes to be able to work in a community-based residential facility, and that has to be completed within the first 90 days of employment. So,
Any other questions? Thank you.
you're welcome.
Next item on the agenda is Health and Human Services Program Review, Aging and Disability Resource Center.
Mr. Chair, every year we try and provide the board with an overview or a review of a particular division maybe, or some aspect of it. And I thought with the new positions that were provided to us in the budget this year in the ADRC and some of the other innovative things that Kristen is doing, I thought it'd be a good time to maybe have her come and speak about that division. So Kristen's got a presentation. I'll let her do it.
Thank you. I'm just going to scroll along here to my slides. Okay. Thanks, everybody. So as Bob shared, I'm Kristen Newton. I am your Aging and Disability Resource Center Administrator. I want to thank you for letting me come here and speak to you today, and I'm honored to share some of the good things that we have going on in the ADRC. Let me just get organized here. Okay. I know I spoke last year a little bit, so some of this is a little bit of a review, but I just wanted to make sure that you were all on the same page before I got into some of the challenges and opportunities that we're addressing right now. The ADRC works to empower individuals to make informed decisions about long-term care, thus assisting in conserving personal resources, remaining independent and self-sufficient, and delaying the need for potentially expensive long-term care services. Some of our key services include the information listed here. So marketing and outreach, public education, we do a lot of community presentations. We provide information and assistance regarding all things aging and disability related. Long-term care options counseling, we have a team of staff who perform that on a regular basis. We have disability benefits counseling that serves individuals who are ages 18 to 59 who are living with a disability. We have elder benefits counseling. Those are individuals seeking services regarding any type of benefits who are aged 60 and older. We also have dementia-related supports, nutrition services, and senior centers. So we have 9 senior centers throughout our county that provide social, recreational activity, social isolation reduction events, things like that. And also our nutrition programming operates out of those 9 senior centers all throughout our county. We also have a transportation program that helps get people to and from the senior center and around in the community. We have a caregiver support program that helps not just the folks who are living with dementia, but obviously their caregivers need a lot of support in that world as well. We also have an adult social respite program called Day Away that our caregiver support coordinator facilitates, oversees essentially, and then we also offer some healthy aging classes. I just would like to note too that each county within the state of Wisconsin is affiliated with an ADRC. They either have an ADRC connected to them or they are part of a regional ADRC. So these are key services that each ADRC essentially provides, but services really vary between ADRCs. There's a lot of nuance and a lot of different programming efforts that go in multiple directions. So it's kind of nice because we can tailor some of our services that are more unique to our residents here in St. Croix County. So in terms of who we serve, the ADRC exists to serve adults in St. Croix County who need support in maintaining independence, exploring long-term care options, accessing disability services, and understanding key programs such as Medicare and Social Security. We're here to be a resource and a guide for adults age 60 and older, individuals with intellectual or developmental disabilities, and those with physical disabilities. Our goal is to ensure that everyone has access to the services that they need in order to live their best lives. ADRCs also provide a great deal of information and referral, disability benefits counseling, and referral for emergency services to adults living with mental health and or substance use related challenges as well. You'll see here, just moving on to some of the key points that we're facing today. I know Bob had shared in previous meetings a little bit about the staggering statistics facing our older generation right now, basically our aging generation right now. As of 2023, the county's population was estimated at 95,044 residents, with 23.3% of them age 60 and older. So that's approximately 22,351 residents who are age 60 or older in our county as of 2023. Between 2010 and 2022, the population of our residents who are age 65 and older grew over 80%, which is pretty staggering. We're facing some pretty unprecedented times in terms of our demographic shifts here. Our total population within St. Croix County is expected to grow even more, 41% by, this is for residents age 75 and older, that's anticipated to grow by 41% by the year 2030, which we're already in 2025, so we're getting close to those numbers too. This obviously reflects statewide trends as well, and just only reemphasizes the demand for senior services as time progresses. Some additional challenges that we're faced with on top of just the demographic is we have worker and caregiver shortages. You know, Sandy talks about how difficult it is to get staff employed at our skilled nursing facility and our local community residential based facilities. It's just difficult to find staff. We're facing a lot of challenges in that area. Family sizes are also decreasing. You know, many years ago, family sizes were a lot larger. Now they're shrinking, and so that leaves fewer individuals available to care for their loved ones as they age. Caregiver and caregiving in general are just shortages that are nationwide concerns. You're probably seeing some of this on national news, that we're facing some pretty scary times regarding caregiving and caregiver burnout, essentially. Families are often the primary source of support for older adults and people with disabilities. In 2024, data reflected that in America, more than 53 million family caregivers provide unpaid care. So that's pretty substantial. It reflects about $470 billion that is attributed to that caregiving challenges that we're facing right now. Data also projects that 1 in 7 current non-caregivers expect to become caregivers within the next couple of years. So 1 in 7 of us in this room will ultimately become a caregiver in the next couple of years, just based on some of this staggering data. And by 2050 in Wisconsin, there will be fewer than 3 family caregivers available to care for each family member over the age of 80. Some additional stats that I think are important to note, that in 2020, we had about 120,000 people in the state of Wisconsin, age 65 and older, living with a diagnosis of dementia, and that's expected to be about 130,000 by the year 2025, so right about now. We're seeing a rise in that population in rural communities. There's a lack of support and a lack of ability to get people to and from. Obviously, in more isolated communities, those numbers are growing. It continues to be an increasing problem here in St. Croix County as well. Obviously, there'll be more people with dementia and fewer resources and lack of staff to care for those individuals. Our services at the ADRC are crucial, as we will be serving an increased population of those living with dementia and their caregivers living in the community, as they're not going to have, they won't have the resources to be effective caregivers, nor will we have beds available to serve these individuals. ADRC intervention is intended to keep people in their homes and in their communities much longer on an independent basis. Our goal, obviously, is to keep people out of skilled nursing facilities. Our impact, obviously, helps prevent other involuntary services and other impacts into other systems, such as adult protection, law enforcement, other crisis systems that are already overtaxed and overburdened. We hope to try to get ahead of that by providing some of our community services ahead of those crisis events. Our funding also has been pretty flat, stagnant since 2008 when we became an ADRC. The service demands continue to rise. Obviously, like I've just been sharing, that 1 in 4 Americans is over the age of 60, or 1 in every 4 Wisconsin residents actually is over the age of 60. So we're expecting that to just continue to grow with time, as I've shared. It's pretty scary. Some other challenges, obviously, are the strain on nursing facilities. Nursing home beds in Wisconsin have declined pretty significantly from 2000 until today. They just continue to decline. It's difficult with staffing, difficult with funding all the way around. Assisted living beds are growing or increasing, which is good. There's some resources there, but funding for them and individuals without resources are obviously funneled through the ADRC to help get connected with those benefits to access those services. So as those demands increase, obviously the demand for our services increases as well. Just want to make sure, obviously keeping people, I just want to highlight too, just obviously keeping people out of nursing homes helps them age more independently and more at their own free will, and it's more person-centered, less traumatic. It's more fiscally efficient for them, as well as it preserves some of their assets and just helps them retain their independence, obviously, which is good for their overall well-being. Looking ahead to the future, the need is really only expected to grow. By 2040, Wisconsin will require nearly 60,000 additional senior care beds, and St. Croix County will obviously share a proportionate part of that demand. coupled with the critical shortage of skilled workers, including nurses and CNAs and aides, these trends highlight the importance of proactive planning and innovation. We certainly cannot influence or impact the total number of beds available in our community from the ADRC perspective, that is, but I wanted to just bring these important facts to your attention to highlight the importance of the skilled nursing facilities that we do have in our county, including our own healthcare campus and the services that they provide to our residents. Obviously, when there's shortages and strains in this area, then the ADRC, like I said, faces an increase in the demand for our services too. So some of that is a little depressing, but obviously with challenges come opportunities, and we're always looking to be good fiscal stewards of the resources that we do have available, and we want to make sure that we're looking at different ways to create efficiencies to meet the rising demands, but also to just be responsible with the funding that we do have available. It creates opportunities for us. So as we face these challenges, we continue to evaluate and see what we can do to look at other opportunities to make sure that we're meeting the needs and also creating efficiencies for our team members so that they can do more with essentially less based on the fact that we're being inundated. So a couple things that have happened. It's been great. You guys were very generous. The county board was very generous in granting us a new position last year that provided us an opportunity to do more with the services or with the resources that were given. We dedicated a position strictly to our ADRC intake team. That individual then provided us with the opportunity to serve more because we had 4 individuals doing that work. Now, we're a year into that. We've been able to evaluate, how does this look? Is this helpful to have a 4th position? We're still feeling inundated. Staff are still being overwhelmed. We're looking at creating, this led to a whole new system shift for me to evaluate what would be a good way to try to meet the needs in a new way so that we can serve the public and not just throw more positions at it without a real good solid plan to be efficient and creative with those resources. So I'll talk about that in a minute, but I do also want to highlight the importance of the volunteers in our services. That's another great opportunity that we really utilize and appreciate. They provide a ton of service for our individuals. I've talked about it before, but in the 2023, we don't have 2024 data yet, but in 2023, we had over 200 essentially individuals who donated over 14,000 hours of time to our division, which obviously saves taxpayer dollars, saves our services, and our resources, and just really helps tremendously with our programming efforts. So we thank our volunteers. They're vital to the success of our programs. So moving forward, just in terms of our new positions this year, as Bob alluded to, we had your guys' generous support to create 2 new positions. And so one of them is a disability benefit specialist. And so that area has been really taxed with a lot of referrals, especially post-COVID. There was a lot of delay with people applying for Medicaid or for disability benefits. And now that's all coming back. They're back to their regular numbers and applications are coming to fruition. And so they've been really faced with a high volume of referrals that have only grown essentially with time, but even more so since COVID. And our program attorneys through the Disability Rights Wisconsin oversee that program, and we've been facing some pressure, if you will, to alleviate some of their duties because their caseloads are just extremely high, just way too high. So a 3rd disability benefit specialist is really helpful and obviously critical to that program area throughout our entire team. The other thing that we looked to do is that, currently, like I was sharing, we have 4 ADRC specialists. Previously, we had 3 for a long time, obviously about 15 years within the ADRC. So now we have 4, and that's our intake or our funnel essentially into the ADRC. So all referrals, anything that you may have a question about a resource for somebody living with a disability or someone who's aging, call into the ADRC. Those 4 individuals rotate this intake And then at the same time, so each day they take a day of these referrals. And then at the same time, they're also doing screening for publicly funded long-term care benefits. And that can take a lot of time. They're out in the community, they're meeting with families, they're helping get people connected to support so that they can be as independent as possible. And so they kind of have a dual role, and it's really taxing because the volume of calls coming into the ADRC only continues to increase. They're often chasing people down the next day. You know, maybe someone's covering Wednesday, it's now Thursday, they're still calling people from Wednesday, and it just becomes a system that's just really not sustainable. And so in 2023, I really set out to try to evaluate, actually late 2023 and into 2024, just to try to evaluate what's a better way to look at this. We've got to have some new ways to screen individuals and provide them with a little bit more comprehensive level of care when they're calling into the ADRC. We had a phone receptionist who's lovely, wonderful, just trying to, you know, listen for keywords and then refer to the appropriate program. And it's just not the best care because they're going to quickly get transferred to somebody. Maybe they want to talk to an elder benefits specialist about their Medicare Part D renewal. But in that conversation, they may find out that they need or that they could benefit from some social opportunities. Maybe they could go to the senior center. Maybe they're home and not able to get out and access the senior center, so they could get home delivered meals. Then they get routed to a home delivered meal, our outreach coordinator for home delivered meals. And it's just a lot of handoffs and bouncing around, and we don't want people to be bounced around. We don't want people to feel like they're not being heard or served in a comprehensive way. So coming full circle, we created this ADRC resource specialist position as a result of this new position increase that we gained going into 2025. And this person is going to provide more of a triage or a level 1 type screening assessment for all calls coming into the ADRC. Oftentimes people call the ADRC and they don't even know what they're looking for or know all of the services that are available. And now we have someone who's going to be trained and skilled in providing a more comprehensive screen, can help funnel those calls to the appropriate team after gathering enough information. Individuals won't be bounced around, hence creating a better, more efficient level of service for those callers, and also creating a workflow efficiency for our team, because now those 4 ADRC specialists can be out in the field doing their screens and their assessments with community members in their homes or in their, in a nursing home or hospital or wherever that may be. So it'll help alleviate their duties, but also help create efficiencies for our consumers who are calling the ADRC. They'll have a better comprehensive care handoff, essentially. So that's what we're looking at. One of the other things I just want to move on, like another opportunity that just helps mitigate some of this crisis surrounding our senior staggering numbers and lack of services available to them as they age, is our nutrition programming. Now, I know this is a program in our ADRC. It's expensive. It's heavy on our budget, but obviously it is a program that provides a really good service to individuals. And I just want to really highlight the importance of our nutrition program, because it allows people to actually age in their homes longer. Nutritious meals provide total wellness. It allows individuals to essentially just be more independent longer. They have access to somebody who comes to their home. If they're getting home delivered meals, somebody comes in and checks on them to deliver that meal. And so indirectly, there's a safety and wellness check on that individual. It's a social connection that they have each day when that meal gets delivered. Going to the senior center for folks who are able to go to the senior center just helps reduce social isolation. All of these things really help contribute to total wellness and longevity, essentially. In 2020, we served about 44,000 meals to both we were closed most of the year for COVID, but we had about 44,000 meals that went out that year. In 2021, we increased to 47,000, almost 48,000 meals that year. In 22, We had over 50,000 meals served that year. In 23, we were about the same, a little less, but about 50,000 meals again in 2023. And then in 2024, we don't have all of our December data yet, but it's annualized, projected to be about 52,000 meals. So that's a lot of meals going out to help people just remain independent in their home as long as possible. And like I said, the more we serve in this program, obviously it, impacts our budget, and the budget numbers increase, but it really mitigates other more costly long-term care expenses for families and taxpayers. Nutrition plays a huge role in keeping people's overall physical and mental wellness in check. It maintains independence. A really important stat that I think is if there's one thing you can take away from my presentation today, is that 1 year of home delivered meal deliveries and the service that accompanies that equates to the same cost as 1 day in a hospital or 10 days in a nursing home. So that just impacts everybody, right? That's just a savings for everyone. If we can keep people in their home and happy and healthy, we obviously want to do that, and it also saves money. It shows that it's really a tangible result that's in a positive. So moving on, just to kind of wrap things up here. So there's also a handout that I have in here that is probably right behind here, just the impact of ADRCs and tribal programs in Wisconsin. I talked a little bit about this last year when I spoke, but I think it's important just to have it in there if you guys take a minute to just go through it. On page 4, it's really impactful just in terms of the investment in the ADRCs. Data reflects that every dollar invested in an ADRC saves taxpayers $3.88. That's reflective of reductions in emergency room visits, hospital readmissions, and also effective use of Medicare resources. There's actually a study that was done to demonstrate this and the impact that an ADRC has. So essentially, when people have contact with an ADRC, if they are hospitalized, they're less likely to be rehospitalized. They're less likely to go back to an emergency room setting because they're going to hopefully be connected to the services that they need in the community moving forward. So I just wanted to highlight that page 4 really speaks to what the return on investment means for an ADRC in the state of Wisconsin.
Kristen,
Yeah.
when they are admitted to the hospital, are they already an ADRC consumer, or how do they get involved with ADRC?
We often get referrals from the emergency room
And
department.
they do that?
Yep. Hospitals and medical providers often make referrals to us, yes.
Okay.
Yeah, or they give them the resources, family members call, the patient calls after they get out or things like that. Yep, it's pretty regularly. So another thing I just want to highlight is that the benefits of ADRCs obviously go far beyond just saving the money. They play a crucial role in improving healthcare outcomes by reducing strain on the healthcare system and enhancing the well-being of those that they assist. These significant cost reductions support the state's financial stability by enabling better resource allocation. Investing in ADRCs offers substantial value and efficiency, making ongoing support and funding critical as we move forward, especially based on the numbers that I shared on our statistics. This is just a graph here. A couple other pieces I just want to highlight, just in terms of our data. So basically just bring this to your attention because our data right now is going to be pretty fragmented until maybe 2026. We have this graph here shows, obviously in 2008 was the inception of the ADRC, and so our data there is pretty minimal. We didn't open until mid-year, so referrals that way were pretty low because it was the middle of a year, and you can see a steady rise. This blue line here is our overall intake calls that the individuals that I was sharing about that we're trying to offset with their ADRC resource specialist. This position here is to help with these intake calls that come into this division here, or into this funnel to the ADRC. So you can see just between 23 and 24, the numbers nearly doubled, or at least doubled just in terms of referrals to the ADRC or calls to the ADRC. Now, the tricky piece that I just want to highlight with you all is that the ADRC throughout the state of Wisconsin, we just recently went through a change in our client tracking software. So the state Department of Human Services for Wisconsin oversees ADRCs and essentially implemented a complete statewide change in our data in our tracking system. So our electronic health record is now new. So this happened in November, and the old system is no longer accessible. So my annual report may look a little wonky this year, but we'll do our best to try to draw some conclusions and show some trends at least for you. But I just want you to know that we're doing our best to capture the right data pieces, but we're not measuring the same pieces anymore because the systems are different and they're capturing different pieces with regards to our referrals. So just want to make sure I'm not missing something here.
Kristen,
Yeah.
what's DBS and EBS?
Sorry, yep. We have a lot of acronyms in our world.
I know.
So DBS stands for Disability Benefit Specialist. So that's the area where we were able to gain that third Disability Benefit Specialist. And then EBS is Elder Benefit Specialist. Yeah. So those are data pieces. You could see their calls have had some ups and downs. We've also had some times in there when staff have been out on medical leave. We've had some transition with staffing too, so you can see where there's some drop-offs. It's probably because we're only capturing data for one staff at a time. I don't have the specific timelines in there, but you can see it's been a little bit bumpy for those programs just because of staffing. Yeah. Another thing too that I think I shared last time, and I know Bob has talked about it too, but the last year, so our ADRC funding, has remained the same since 2008. In 2024, the state went through a increase in the budget for ADRCs as part of the statewide biennial budget. With those increases for ADRC funding came a new formula to calculate the funding distribution, and that resulted in us losing funding, which is ironic considering the demands. But the state is holding each county that lost funding as a result of this formula, they're holding them harmless. So we won't lose funding, it's just that we didn't gain any funding like we had optimistically anticipated. We also recently received a nice offset of some funding in late 2024 from some unspent dollars throughout the state that they reallocated, so that was helpful. Obviously, because our budget, especially with nutrition, it was, obviously needed a little bit of help there. And we also recently received a $25,000 grant from the state to refresh our logo and marketing materials. So the state went through a whole process to evaluate the effectiveness of the ADRC logo. You'll see it. I have a handout for all of you, but you'll see our little signature logo has changed just ever so slightly, but they had some ARPA money that they delegated out to different counties to utilize if they so chose to increase or to refresh their marketing materials. And we're always ordering new brochures, so I figured why not? Free money is free money, so let's get the money so that we can not have to pay for printing of our materials anyway. Yeah, so looking ahead, our commitment in the ADRC remains unwavering. We have a great team. I can't highlight their dedication and commitment to this work enough. I mean, we have staff who've been here over 25 years that are just really dedicated to not just to St. Croix County, but to the ADRC and the work that we do here. So I think that that's really worth mentioning. We're always continuing to find innovative ways and creative ways to improve efficiencies and manage costs. We're trying to meet the needs of our growing population while also managing those costs at the same time. Your ongoing support and advocacy for ADRCs are critical as we work together to obviously build a sustainable and impactful future for our community. Thank you. Do you guys have any questions for me?
I'm glad you mentioned the funding because that was going to be one of my questions. My other question is, these ADRCs are kind of a uniquely Wisconsin by county program. It's so cool because I work with people who live in Minnesota, And I explained to them, because they're talking to me about having a parent that maybe needs some supports or whatever. And I said, well, we have this great thing in St. Croix County, called ADRCs, but they really don't in Minnesota. So I think this is it's a wonderful one-stop shop. And I can't tell you how important it is for us to get the word out about it. Even just a one-time call when you're trying to figure out what to do with Medicare. If you're just going to be turning 65 and you don't know what to do or whatever, I had my husband do it as kind of like I said, really just do it, because that's we have these specialists, and even if it's one time that someone calls, it's worth it to help them through this, to navigate through the maze. So you guys do great work. Thank you.
Thank you. I appreciate that.
Kristen, thank you so much. I cannot echo that loudly enough how important the work of the ADRC is. I mean, we're already in a crisis state, but that crisis is going to continue to grow as our population ages and our resources in the medical field continue to decline. So absolutely, this kind of upstream work, I can't say enough about the work that you're doing, and appreciate the creativity that you present in this. It baffles me, the resourcing that you're dealing with, but again, even the food, the nutrition resources that you provide. I know it looks like a big cost, but it truly is an upstream impact that will save us all resources, money, and support our communities. And so this is just incredibly, incredibly important work. So thank you for what you're doing. And I agree, we need to get the word out. We are really fortunate to have this. I'll tell you, every time I talk to our social worker about supporting the patients that I work with, which is very frequently, the ADRC comes up. And the support that they receive is just fundamental to caring for our population here in St. Croix County. So thank you.
Thank you.
Any more questions? Is it my
Mr.
understanding
go ahead.
Is it my understanding that you saved money on changing publishers of your newsletter?
That is correct.
So you're making better use of your resources that way.
Yeah.
Who gets that newsletter? How does somebody get on the mailing list?
Oh, yeah, that's a great question. You can, individuals can call our office, email our office, or sign up through the website. So there's a link on the website to sign up to get it electronically.
Is it age related?
No, absolutely not. No.
Well, I used to get it,
Oh, really?
and you dropped me. I get it. Seriously.
We didn't mean to.
I just thought I was younger.
No, anyone can get on the newsletter mailing list, and we had a change in our mailing list. So as of the beginning of 2024, we had worked through trying to clean up our old mailing list, because we had heard from family members that they were receiving their dad's newsletter for the last 8 years, and he had passed away, and they were just throwing it in the garbage. And so I realized that we were spending a lot of money on postage, and so we worked to try to clean that up. And if people want to be on the mailing list, they still can get on the mailing list, but we're saving about $2,000 a month in postage just by that one quick change. So,
sure.
Yeah.
But no, it's a great, I like the new format. It really looks
Okay.
great. And, yeah, appreciate it.
Thank you.
Oh, okay.
I'll make sure you get on the list, Supervisor.
Thank you. Bob, did you have something?
Yeah, is my mic on? Yeah. First of all, I think we're very fortunate to have Kristen as the leader in our ADRC, and she does consistently look for opportunities for looking at the same problem from a different angle and finding different solutions. And I think that's very refreshing, and it's something we promote, obviously, in the department, but very lucky to have her. And I was just going to ask if she could give perspective maybe on this point, but as she explained and Dr. Finley pointed out, we knew this demographic shift was coming for years, and now it's here, right? And we weren't blind to that, so we were trying to prepare a bit for what do we do as a department in response to an aging population, a diminishing workforce, and all of those challenges. So when we look at things like the dementia care, dementia crisis stabilization unit, the ADRC, and our adult protective services, we look at these kinds of issues that are coming that will impact all of healthcare and really our economy. we try and look at what can we do as a department collaboratively within our department to address this as effectively as we can. So when we look at the dementia care or Dementia Crisis Stabilization Unit opening, that's a great component of that. The ADRC is a great, like you said, Doctor, upstream set of services. And then we have our adult protective services, which are more after something has happened, addressing that with our seniors. So when we look at grant opportunities and funding opportunities, we're not lost. It's not lost on us that connecting these things makes sense, right? So Kristen and our APS supervisor, Sean Post-Priller, take part in our weekly meetings about the Dementia Crisis Stabilization Unit so they can have input on how do these different areas of HHS collaborate and work together to address a similar population. So I was just going to ask you, I didn't prep you for this, but if you could kind of, though, from your perspective, just give a brief summary of how the ADRC, in taking part in those meetings, how you see the ADRC really contributing to the overall system of response that we have with the DCSU, the Dementia Crisis Stabilization Unit, our APS grant that we just got for dealing with abuse in later life, and how those things connect from your perspective, because I know you have a background in APS and that sort of thing too.
Yeah, certainly. So, it's a little bit tricky because obviously our goal at the ADRC is to keep people out of a facility like that. We're trying to do these upstream tactics to, prevent crises from occurring after if there's a missed opportunity. So my hope with this whole shift in our triage system is to help serve people more timely so that they can get connected to services so that they don't access those types of interventions. So we can try to prevent the role of APS getting involved, try to prevent the impact of, or try to prevent, an admission to a crisis facility. Now, certainly that doesn't always happen. We can't reach everyone. It's not a result of a failure or an incompetence if that does end up happening. But obviously that's our goal, is to try to get ahead of these types of situations. But if it does happen, obviously we have a relationship with adult protection. We work closely together, try to ensure that we're, our options counselors provide screening for placements and try to get people connected so that there is a support system. Somebody may have to go to a facility or may have to be placed for their own safety or for their own well-being. And so we're really the link to get people connected to that service. So if they need help in supporting funding for either a placement or an in-home support, sometimes we're able to provide services to individuals in their home to prevent, maybe they're at a level where they don't need 24-hour supervision, but we can help get them connected to family care so that they have a service to help support that. So we're trying to get ahead of that and get people connected so that they don't ultimately result in that level of care. But if they do, obviously we're there as a good support. Want to make sure that people are aware of the ADRC, similar to a hospital admission like I talked about. We want to make sure that the folks who are leaving the Dementia Crisis Unit has access to what is an ADRC, how can I utilize them in the future to help prevent me having to come back here or my loved one having to come back here, or have more involuntary service connection with adult protection or law enforcement, that sort of thing. So we partner in that way. Does that help, Bob?
Yeah, it does. Thank you. And the other aspect of the grant that we got for APS is that it involves law enforcement, the DA's office, judges, and others that can be trained then in adult protective service in recognition of situations that they maybe weren't as well informed about, and help us as a system work more collaboratively across divisions, departments, whatever the case may be, and community providers to try and address this problem that we know is coming, not problem, but this reality that we know is coming, where we're going to have a huge increase in our aging population, and those needs that go along with that just compound the urgency, I think, to address them. So I appreciate your insight, your innovation, and all the hard work you do. Thanks.
Thanks, Bob. Other questions?
Any other questions? I assume you work closely with Adam there.
I do.
You he's keeping our website up to date on the ARC and all that.
Absolutely.
Thanks. Thank you very much for all your work and a great presentation. Thank you.
You're welcome. Thank you.
That's it for business items. Requests for future agenda items. Anybody have any suggestions or questions that would like to be addressed in the future? Okay, hearing none. Any announcements, please?
I wasn't paying attention, Mr. Chair. I was asking Colleen if you had the handouts that we wanted you to look at. All right. My first announcement would be on that handout. There's an interest in using technology. Yeah, that's it, the Translate Live device. So my announcement is that we are looking at ways in which to use technology to help us in the area, in this case in interpreting and translation, to save costs really from using our language line or having to look for an interpreter, thank you, translator, that might cost significantly more. So we looked at this technology that you have in front of you for our public health division and for our behavioral health division. And we purchased the device that you see there through grant monies in both divisions for about $3,000 for a 3-year subscription. And it includes the device itself and the software support, all of that. But the idea here is you can have sort of a double-sided iPad that you can use to use from voice to text, text to voice, or just talk to somebody with this device using, I think it has the capability up to 200 different languages that can be translated. So I just wanted to let you know that we purchased 2 of these. We're in the process of testing them out in real life, and then we'll be able to come back and provide a demonstration of how they work and measure how effective they are in saving costs and things like that. I wanted to announce that Children's Services was awarded a grant to develop a family treatment court model here in St. Croix County. It's $125,000 per year for 3 years. We just got the award announcement for that. We're still waiting for the contract from the state to come through. And I think it was really Jessica Dodge, a supervisor in Children's Services, that wrote the proposal. She did a really nice job with the proposal. It was a competitive grant. But she's going to be talking a little bit more about that at the CJCC meeting tomorrow morning, and she'll also be able to report on that, or I can, in the future, so that you have a better understanding of what's involved with that grant and what progress we've made with it. So we just got that award announcement. Wanted to announce real quick that currently, well, they're just wrapping up, but Shar Lopez, our deputy director, Sheriff Knutson, District Attorney Anderson, Sean Post-Priller from APS, and Samantha Pearson from Turning Point all attended a 3-day training in New Orleans. It's a required grant orientation training for this abuse in later life grant that we've talked about in past meetings, but they just wrapped that up. And again, just back to Kristen's presentation, this is a way that we're expanding sort of the scope of who's involved in APS work and how we coordinate that between departments and community providers. So they're wrapping that up, and they should be back tomorrow or the next day. 2 more quick. Reform Medicine, the on-site clinic provider, will be opening a clinic in their clinic in New Richmond at our services center 1 day a week on Tuesdays beginning February 4th. We have a space there where the people can come in, a little waiting area, and then we're using our public health exam rooms as a place where the physicians can see patients. So February 4th is the start date for the New Richmond location, although Reform Medicine's available for our use now in other locations currently. And the last thing I wanted to mention was we have it was on our town hall meeting today, but we have a vending machine that we had ordered a while back for harm reduction products that we finally received in mid-late December. That's in our vestibule area, the main entrance of the services center right now. We have to connect it to Wi-Fi. We've been working with IT on that, and then fill it with products that we have stacked up all over the place. But that's going to be a location where anybody from the public can come in and pretty discreetly get these harm reduction products like Narcan and drug disposal kits and safer sex kits and really any harm reduction product that we can fit in the machine, and just get that for free without coming into the building. So the machine's there, we're just trying to hook it up and get it stocked, and we'll be ready to go. I think that's everything.
Thank you. Any other announcements? Okay, date of our next meeting is scheduled for February 19th. And I appreciate everybody coming in tonight. Stay warm and healthy. We are adjourned.